Sheila, here you are 12 years later. How are we seeing?
12 years later, I'm 20/20 and I don't have to wear glasses or contacts.
I love it, love it. Any pain, anything going on?
No pain, no problem at all. Just came for my checkup and got passing grades on everything.
Beyond passing grades. Yeah. So doctors, you're always watching. I'd love to share with you all. These are cases of radial keratotomy. Patients, as you know, they have multiple cuts on the cornea, irregular astigmatism, difficult to measure, and changing measurements. Through that to do their cataract techniques with the LenzOplastique concept. We did surgery on this wonderful patient of mine. She's a flight attendant, and 12 years ago.
12 years
And we
ago.
did LenzOplastique and brought her to 20/20, still 20/20 at this point. Actually had the pleasure also operating on her husband right here. He's a pilot, right? No?
Yes.
Correct.
How are you doing?
My vision's great, 20/20. I just thought this morning driving over here, I can see my dashboard without wearing glasses. I mean, it's great.
Everything.
It really is.
Lovely, lovely. And very important, doctors, please look at these things. You'll see the irregular astigmatism. The cornea is very disturbed. There is 6.8 diopter astigmatism. But you may neglect this as long as it's stable and measurable. Remember my two words I keep teaching, right? As long as it is stable and measurable, the cornea, you can then do an intelligent lens-based surgery to fool the optics to make sure the eye is in focus for the brain. That's the concept of working on all these irregular corneas and scars and radial keratotomy and refractive complication cataracts. All right? And as I keep showing you all and sharing with you, real patients on camera, and these are none of them are ordinary patients. We don't advertise at all, so they all come here with intensive research, even skeptics sometimes. Sure. Yes?
Oh, I was ready.
Yes. And as patients keep landing today for their first visits here as they're arriving today, I'm seeing my own patients here in follow-up. So it's a pleasure to share with you all. Again, do not get besotted by the irregular corneas and the looks and the topographies. All this is great for the study. But as long as the cornea is measurable and stable, you can go and do lens-based techniques using premium toric technology, fix the optics so they cancel the aberrations of the cornea, and you bring the patient straight to vision. All right? Oh, great. Sheila, a pleasure as always.
Thank you, Doctor.
Norm?
Pleasure to see you.
Thank you, Doctor.
Great to see you again. Absolute
Good
pleasure.
to see you.
Pleasure. Please.
Hi, my name is Sheila. I'm 63 years old. I'm a retired airline flight attendant. And I had RK done years ago, and after about 15 years, my vision just started deteriorating drastically. And there are very few doctors that would do anything about that and said I would eventually go blind. I was directed to Dr. Gulani, where 12 years ago he did the LenzOplastique surgery, and 12 years later I am 20/20. I don't wear glasses or contacts. I do wear reading glasses occasionally if it's dim light, small print, but what Dr. Gulani is doing is nothing short of a miracle for us RK patients that have only blindness in our vision if it's not corrected. So I implore you, if you're having this issue, to ask your doctor solutions to get you better vision.